two themes is the incredible staff we have in these areas. The services at the EIB can both use their financial expertise, second to none, in construct very attractive financial packages, attractive both for us and our clients and partners, but also we have the subject matter expertise in energy and life science and health and many other areas, with engineers, medical doctors, life science expertise that is quite unique for a bank like us. So that is a strength that we have. And in the field of health and life science, we have the opportunity here to work very broadly. We are investing venture debt deals with very innovative small and medium-sized life science companies that have innovations, cutting-edge innovations, where we can support their scaling up. We invest in health infrastructure, in education of health workers, in vaccination campaigns, in hospitals, and many other types of infrastructure investments. And we can do that thanks to the expertise that we have in-house. And it's the same expertise that works inside the European Union and outside the European Union, which is also a strength, I think, because the transfer of knowledge in both directions can be very, very important. So we have touched upon in almost all sessions on the global geopolitical order that is in a bit of disarray as we speak. And we had the chance yesterday to listen to Dr. Tedros, the head of the WHO, one of our strong partners in the field of health, and his explanations of the situation that this important organization is in. But it's also a very good example of what is needed now, and that is partnerships. Partnerships to be able to invest in health and thereby strengthen people's possibilities and lives. So health challenges knows no borders. And of course, health challenges varies by region. But the need for equitable access, resilient health systems, and sustainable financing is universal. The COVID-19 pandemic took its toll on global health. It basically reversed over a decade of gains in life expectancy. And now we are seeing the immediate consequences of countries like the US freezing financing to very important health areas. At the EIB, in partnership with the European Commission under the Global Gateway Initiative, we have committed substantial resources to support health projects around the world, especially through our valued global partnerships. And let me give you a few examples that I think can illuminate how we want to work and how we are working right now. We are, for example, partnering with the European Commission and the Gates Foundation to build the Human Development Accelerator, HDX. That is an 800 million euro facility that targets unmet medical needs worldwide, supporting local solutions for healthcare. It can be production of essential medicines, it can be vaccine production locally in Africa, for instance. It can be support to innovative companies that are ready to take their ideas in partnership with low and middle income countries. Also with the Gates Foundation and the European Commission, we provide 500 million euros to support WHO and UNICEF in the implementation of the global polio eradication program. In fact, immediately after this panel, we will hold a short celebration ceremony of what we have achieved up to now together under this polio initiative. An innovative way of working together in a crucial global health area. Also in collaboration with IFC and other development finance institutions and Team Europe partners, the EIB invests in health preparedness, healthcare infrastructure, and pharmaceutical production. In fact, in New York last year, during UNGA, we launched the Surge Financing Initiative to be prepared for the next pandemic and use the lesson that we learned to be even more efficient. With WHO and the European Commission, I would like to highlight another joint initiative that we have taken. Together with the African Development Bank, the Islamic Development Bank, and the Asian Development Bank, we have launched the Health Impact Investment Platform. Together, we commit to invest over 1.5 billion euros in primary healthcare, the cornerstone of a functioning healthcare system in low and middle income countries. This platform has now moved into operationalization, and I'm very much looking forward to see these crucial projects, crucial investment being financed and rolled out. Our partnership with GAVI, of course, predates the pandemic, and with Team Europe, we have been strong supporters of COVAX, which closed at the end of 2023, and today we remain committed to GAVI and the essential work that they do. Over the last 5 years, the EIB has provided more than 22 billion euros in financing to projects in the health and life science sector, and around 5 billion of those in countries outside the European Union. Our engagement in the health sector spans over many areas: infrastructure, medical innovation, health system strengthening, access to essential medicines. And our support aims to not only address the immediate healthcare needs, but to build lasting, resilient systems that can adapt to future challenges. An interesting example also represented in the panel is our cooperation with BioNTech. Before the pandemic, we were partners in financing their cancer-related research. When the pandemic hit, we agreed that we were able to finance their attempts to create a COVID-19 vaccine, which they very, very quickly succeeded to do. A couple of years later, they even inaugurated their facility in Rwanda for local vaccine manufacturing. What an interesting example of how cooperation inside the European Union and outside the European Union goes together. And today's moderator, Mr. Sall, head of the Institut Pasteur de Dakar, is another example of these type of activities. To reduce Africa's dependence on imported vaccine and support equal access to vaccine, we have been partnering in financing local manufacturing vaccine capacity in Dakar. This is a very important thing in an African context, a continent of 54 countries, 1.2 billion people, which currently produces only 1% of the vaccine it administers. We are working on similar projects with other African countries. With these words, I would like to say that I very much look forward to the panelists coming up on stage and having a very important discussion on the health challenges ongoing. Thank you very much for your attention.
Thank you so much once more, Thomas. And as alluded to, we have a great panel ahead of us. It will be moderated by Amadou Sall, who is the Chief Executive Officer for the Institut Pasteur Dakar. And his panelists are Ted Chaiban, the Deputy Executive Director for Humanitarian Action and Supply Operations at UNICEF, the United Nations Children's Fund. We have Felicitas Riedel, who is the Director of Innovation and Competitiveness at the EIB. Michael Ryan, the Deputy Director General for the World Health Organization. Bjorn Gilseter, the MD for GAVI, the Vaccine Alliance. And Ryan Richardson, who is the Chief Strategy Officer for BioNTech. Welcome to you all.
Thank you very much. My name is Amadou Sall. Good morning, everyone. I'm the CEO of Institut Pasteur in Dakar, as discussed by VP Östros. It's a great pleasure to be here to celebrate partly the partnership we're having with EIB that is helping us actually to work in Africa and strengthen capacity for vaccine manufacturing. Today, actually, we bring together key global health leaders to discuss how strategic alliance can have meaningful impact in addressing health challenges worldwide. Global health is a shared responsibility, from pandemic preparedness to vaccine equity, from strengthening health system to fostering innovation. The complexity of global health requires collaboration, not only between government, multilateral organizations, but also with the private sector and the civil society. The partnership is not only desirable, but it's also essential. In the next hour, what we are going to do is to explore how leading organizations such as EIB, GAVI, UNICEF, BioNTech are actually working together to enhance resilience and to preparedness, as well as putting together equitable solutions to health. We will hear from distinguished experts who bring unique perspective on framing innovation. and how to respond to health emergency and ensuring that investment translate into sustainable and impactful change. To start the discussion, I am going actually to turn to Bjorn Gilsetter, who is the Managing Director of GAVI, the Vaccine Alliance. Beyond GAVI has played a crucial role in global immunization over the past 25 years, vaccinating more than 1 billion children worldwide. Congratulations, because this is an incredible achievement. As we look ahead, what are the next steps, GAVI, and how can strategic partnership with public health, with public and private institutions help to address the pressing global health challenge today and tomorrow?
Thank you, Amadou, and I'm delighted to be here. It's really an honor. Thank you, Thomas, for the invitation. It's actually, for me, a bit of coming back. My professional career started 30 years ago as the first Swedish EIB desk officer from the Ministry of Finance. And in those days, it was all about infrastructure and financial sector. Had I suggested that we should hold a forum on global health, I think management would have laughed at me. The institution has come a really long way, being nimble and being responsive to new global challenges. So congratulations to you. Let me say how pleased I am to have the EIB as one of our really solid and very significant partners. The partnerships really took off in year 2020 as part of the COVID response, where you lent some 600 million euros to us as part of that response. Now, over to GAVI. We are a private-public organization with a fairly unique construction with partnership built into our DNA. In fact, it's in our name, GAVI, the Vaccine Alliance. The alliance consists of the WHO, the World Bank, UNICEF, and a small GAVI secretariat. And yes, indeed, we have achieved a lot since the creation, the setting up of GAVI 25 years ago. We estimate that 1.1 billion children have been vaccinated around the world in the 76 countries that were originally GAVI beneficiary countries. That translates into an estimated 18.8 million lives saved. There are estimates that in turn has generated 250 billion in economic benefits to the beneficiary countries by lowering healthcare costs and boosting productivity in these countries. And just to give you one more figure, today a child born in a GAVI-supported country is 70% less likely to die from a vaccine-preventable disease before their 5th birthday than before the year 2000. There are two aspects of our work that I want to emphasize. One is that we have sustainability built into our model. All beneficiary countries, we now have 56 countries, 19 have graduated from our support. All these countries, no matter how poor you are, they have skin in the game. They all pay a price of the vaccine that they receive. That the cost that they carry increases as they move closer to the cutoff point of 1,800 GDP per capita. And I think at that point, they carry 40% of the cost. That in turn, and I think it's important to underline this partnership dimension with the beneficiary countries, because the money that they put on the table for vaccinating their children, the 1.1 billion children, over the next 5 years will amount to $4 billion, almost 40% of the total cost of our work. Second aspect is that all our work is characterized by innovation. It's across the board. Many of you probably know about IFIM, the International Financing Facility for Immunization, which leverages the power of the international capital markets to front-load donor commitments and create funding predictability for the vaccine industry. We've also innovated in the way that vaccines are delivered on the ground, including the work that we do together with Zipline, where we deploy drones to drop vaccines to local healthcare institutions out in remote areas. There are three parts to our work going forward for the next 5 years as we look to our new strategic period in 2026 to 2030. First, we talk about protecting the world, and this is short for health security. We build stockpiles of life-saving vaccines for sudden outbreaks, whether that's cholera, Ebola, or yellow fever. We have financing arrangements ready at hand so that we don't have to scramble like we did during COVID when the next health emergency of international concerns comes around, like it did last summer with Mpox or the Ebola outbreak in Uganda just recently. And in this regard, the EIB has been a great partner, including supporting our zero-day financing facility with 1 billion euros. So thank you for that. Second is protecting people. Over the next 5 years, we will double our speed of vaccination and vaccinate 500 million children, including, and this is one of our key priorities, to reach those tens of millions of children who currently are what we call zero-dose children, who haven't received one single vaccination. And finally, protect communities by investing in health systems strengthening, supporting local health clinics in rural Chad or Ethiopia that actually gets the vaccines into the arms of children. Thank you.
Thank you very much, John. Really, you give us a very good insight how these strong partnerships help drive the global immunization program. And I think this is also a good way to show how partnership can support people that need the most those vaccines. Building on that, I just would like actually to turn now to Ted Chaiban, who is the Deputy Executive Director for Humanitarian Action and Supplies Operation at UNICEF. Ted, UNICEF play a critical role in global health, definitely, not only as the largest procurer of vaccines, but also delivering essential health service to children in crisis-affected regions. UNICEF has been at the forefront of several initiatives, such as Global Eradication Program for polio, that we're going to be celebrating a little bit later. But also it addresses as a pressing health challenge. How do you see the complementarity between your institution and the public-private partners achieving your goals?
Thank you, Amadou, and thanks to EIB for having us on this panel. The first point I want to focus on is at a time where there's such a questioning of global partnerships, of global ODA, it's important to remember how much we've achieved. And we've seen a huge drop, a child survival revolution, a drop in under 5 deaths to less than 5 million in 2023. That's a reduction of more than 50% in under 5 mortality since 2000. And this has been achieved first and foremost by countries in the lead, using their domestic resources. But international partnerships have been part and parcel of this effort. Whether it's GAVI, we just heard from Bjorn, whether it's the Global Polio Eradication Initiative, whether it's the Global Fund, we've all come together to contribute in our different ways to this child survival revolution. And it's also fair to say there's much more to be done, specifically in fragile and low-income countries. As we sit here today, 200 million children require humanitarian assistance, and 50% of remaining preventable mortality is in those contexts. So we need to focus on those environments. We need to focus on low-income countries and continue the journey towards zero preventable deaths, which is what the SDGs have asked us to reach. UNICEF is a proud member of these partnerships and these alliances. We bring our own comparative advantages, everyone on stage and many in the audience do. In our case, it's the work on supply and procurement capacity, our work on risk communication and community engagement, our field presence and the focus on last mile delivery, which was so important during polio. And then because we focus on the child and we're multi-sectoral, all of the work on social determinant of health, so work on education, on violence, the environment around health that needs to be addressed. But let's be clear. Countries are at the center, governments are at the center of what we need to achieve together. And, you know, Bjorn spoke about the results that GAVI Alliance supports. When it comes to GPEI, our efforts have helped vaccinate 370 million children against polio every year, reducing cases by 99.9% and eradicating 2 of the 3 wild polio viruses. So, you know, that it takes a village approach works and needs to continue to be in place for us to achieve global health outcomes. Viruses don't know border, and neither should our work. And it's important that we continue with a focus on equity going forward. And I have to say that the EU has been a key player in prioritizing health in its global strategies with the adoption of the Global Gateway Initiative. And looking forward, I'd like to focus on 3 areas for us to work together. Firstly is the whole issue of strengthening local manufacturing capacities. And I know, Amadou, this is very close to your heart, with a very strong focus on health and nutrition commodities, especially in Africa, where it's so needed. And I think we all want to work together with Africa CDC, African member states, local private sector, the EC, the financial power of EIB to catalyze our support for the AU's platform for harmonized African health manufacturing. Second is strengthening vaccine and medicine pool procurement and forecasting capacity. A lot of the market shaping and bending that Bjorn spoke about was made and realized by international actors. Why not work in a way now that African countries come together or Asian countries come together to bend the market in the same way that Europe is doing so for the procurement of vaccines? And third is a focus on primary healthcare. I was the global lead coordinator for COVID-19 vaccination. And frankly, I saw that in some ways, the weakest link was the final link. How do we focus on primary healthcare and that connection to community level structures, which is really how public health needs to be delivered. Let me end with one example of the kind of transformation that we can work on. At the onset of COVID, 85% of manufacturing of WHO pre-qualified auto-disable syringes was in Asia. 85% of production was in Asia, but 2/3 of demand was in Africa. That's not an equitable way of working. UNICEF, working with other partners, identified 2 factories, one in Kenya, one in Rwanda, to produce auto-disable syringes. Working with Gates and other partners, there was investment made in those 2 companies. Today, 40% of auto-disable syringes are produced in Africa. That's the kind of progress that we can make going forward. Thank you.
Thank you very much, Tate. I really like your focus on local manufacturing, but also the link it has with the health system and how we can make those 2 links. I think for me this is so important. We keep talking about vaccine not saying saving life, but really the vaccination that would save life. That's why the health system is so important. Building on that, I think there is some tremendous work that has been done during the COVID, and I really want to shift onto the private sector perspective. Clearly, I would like to turn to Ryan Richardson, which is the Chief Strategy Officer of BioNTech. BioNTech has been the forefront of vaccine innovation, particularly in the messenger RNA technology, which has transformed really global health response when it comes to infectious disease. Ryan, BioNTech is aiming at improving the health of people worldwide through fundamental research and development of immunotherapy, for instance, as well as vaccine manufacturing capacity. And VP Östros mentioned the work you're doing typically in Rwanda. So I'm very interested to know what is the type of financial product that you're looking for from companies like BioNTech in order to sustain innovation and research and beyond in contributing to the development of local capacity?
Yeah, thank you, Amadou, for the question, and also thank you to the EIB, Thomas, for the invitation to be here, and also the partnership over the years. You know, I think that the financing support that we're looking for can come in different shapes and sizes and different flavors. I think underpinning, though, the different types of financial support that is most helpful is really a common theme, which is, you know, we're looking for strategic partners that share a common vision, that can help us mobilize resources that maybe we don't have direct access to, and really join forces in a sort of win-win partnership for the long term to achieve shared goals. You know, and I think there's a couple of different specific types of partnership and financing mechanism that have been particularly useful to us. I think the first is a topic we've talked about already here a little bit, which is infrastructure support. You know, BioNTech, as an innovative biotechnology company, didn't have a global infrastructure. Certainly pre-COVID, we didn't have that. And so we weren't in a position on our own, even though we had great translational science, great technology platforms, we were not in a position to really globalize products in such a short order. And it was very helpful to team up with different institutions, starting with the EIB, as Thomas mentioned, actually, pre-pandemic in the cancer field. And that was a really helpful loan instrument, 50 million euro. And it was really, again, premised on this shared commitment to foster innovation in Europe. And we put that towards building out of our infrastructure for personalized cancer immunotherapies, which we were really, and still are, at the forefront of. You couldn't outsource that to a CDMO partner. We had to build it from scratch internally. And then as we came into the pandemic situation, actually pretty early on in the pandemic, we made the decision, we made a commitment publicly in 2021 that we wanted to establish on-the-ground mRNA production infrastructure in Africa. Of course, we had no on-the-ground presence at all in Africa, and also didn't have it in many other regions. But that was very important to us because we recognized that there was a mismatch already, of course, and we wanted to try to do something about it. We had also developed a technology, a modular mRNA production technology called the BioNTech, which would allow us in pretty efficient fashion and also quite rapidly to establish a production infrastructure that could serve millions and millions of people per year with new vaccines. Not only the COVID vaccine, but also the rest of our global health portfolio, which we had also made a decision to expand in during that time after the validation of COVID. And that included new vaccine programs against malaria, against tuberculosis, against HIV, and so on and so forth. And it was extremely helpful when CEPI came in, along with other partners as well, and committed up to 145 million to support that effort to establish mRNA production infrastructure in Kigali and Rwanda, again, with the shared aim to provide equitable access to vaccines, not only a COVID vaccine, but also other vaccines from our global health portfolio, with a particular focus on prioritization of access and affordability for the African continent. So there again, you see a shared vision, and I think very close alignment, and CEPI bringing funding, but also know-how and its own set of alliances to the partnership, I think very helpful. And we've then since replicated that, expanding into Australia, here in this case through a public-private partnership with the state of Victoria. So not only national governments, but also regional governments, to also install a BioNTech facility in Australia with the aim of fostering an mRNA ecosystem locally. So that's the first type, which is infrastructure financing. The second type is product-specific financing. And here again, I'll point to a support that we've received and continue to receive from CEPI, in particular to develop an mRNA vaccine against monkeypox. This was up to 90 million in support with the shared aim of developing a monkeypox vaccine and generally a platform that could go from pathogen recognition to commercial scale manufacturing and launch within about 100 days. That was the ambition. That would be obviously even faster than the 10-month period that we took for COVID. So again, I think that would be very helpful. I think one point for the future that I would mention where I think, I see particular promise for us to do even more with partners would be in the area of advanced purchase agreements for specific programs. I think, from our perspective, we have this ambition to help people around the world with our technology. And it's not only profit motive that comes into how we think about that, but the reality is that some of these vaccine programs may cost $500 million for an individual program with enormous binary risk. And I think, if we can find partnership structures that allow us to have some sort of advanced purchase or advanced sort of a de-risking of the market opportunity a little bit, I think, and a sort of sharing of risk with different partners, I think that could really be a win-win and unlock a lot of innovation potential for different groups of different parts of unmet need around the world.
Thank you very much, Ryan. I really like also, from BioNTech perspective, all these science and capacity building on the human resource perspective brought to Africa, because that would also nurture the future of manufacturing, which I think is critically important. The R&D and the innovation, for me, are really the foundation to help building all this local capacity to be able to make product, and that would help all the global health security. Talking to global health security, I'm going actually to move to Mike Ryan, who is the executive director of WHO, and was in charge of emergency program and also deputy director general. Mike, the WHO plays a pivotal role in coordinating global health response and ensuring that resources are effectively mobilized to tackle both emerging and long-standing health challenges. With the shift on global health donor landscape, how is the WHO adapting its strategy to maintain strong partnership and ensure sustainable funding for critical health initiatives?
Thanks, Amadou. Yeah, well, the first thing we probably all need to collectively realize is that no matter what the funding situation is, the fire service has to work. It's not a choice here. This isn't, we'll do this, we won't do this. So I think from WHO's perspective, it's really now looking with our member states, with our partners, at what are the actual priorities within what has been established as priorities. A global program of work was agreed between 194 member states last year for the next 5-year cycle in global health. That was costed at a certain level. We all recognize that that costing may be unrealistic now. Just like if in any of our homes, when the funding bundle, when the salary drops, you have to sit down with your family and say, okay, what is it? Is it the music lessons? Is it the car? Is it the family holiday? Everything is important, but what's most important? And I think that's where the partners need to work together now in the coming months, especially, is to maintain our partnerships. The worst thing that can happen in a crisis is that we lose cohesion and we turn on each other, be that at community level, at national level, at global level. We're all in this to build partnerships. Those partnerships are as much determined by passion and commitment and a pursuit of equity as much as they are by contracts and money and everything else. We have a shared human goal of reducing human suffering, increasing human security. Health is security. Health is defense. Health is peace. And we all believe that, but wherever we come from in the different sectors. The power we have in our partnerships is no one has all the solutions, and that sometimes is seen as a weakness. No one can do this by themselves. It's terrible. Well, actually, that's fantastic, because that allows us to have the humility of depending on others to deliver. You mentioned the ICG mechanisms. People probably don't realize, but long before COVAX, we have 4 global mechanisms for Ebola, for yellow fever, for meningitis, and for cholera, in which vaccines are made available free of charge to all countries suffering epidemics, and that vaccine is only distributed on the basis of need. That ICG mechanism is a 25-year partnership between WHO, UNICEF, the Red Cross, MSF, the Center for Disease Control in Atlanta, and GAVI as well. We had different mechanisms, and they were all half working. But we got together a number of years ago and said, hang on a second, UNICEF should be the one doing the procurement on the vaccines and distributing it. GAVI should be doing the market shaping and doing the financing. We in WHO should be focusing on the epidemiology and the decision-making architecture, and then downstream UNICEF, Red Cross and others. And in realigning all of that, we got huge efficiencies, and now we manage all of those products within one system. It's actually costing less to do than it did before because we're doing it better together. And I think we have collectively demonstrated that we can approach these complex problems with a public-private partnership, with an agency-agency partnership, and more importantly, an increasing need to partner with the countries and the people we're serving. I had a conversation a couple of years ago with the Minister of Health from a very large developing country in Africa. And he said to me, he said, Mike, I have 84 different health representations, international health representations in my capital city. And every one of them has a plan for me. The only plan they haven't read is my plan. You probably resonates with you, Amadou. And that's why I really, the way in which EIB are partnering with everybody, I really, really appreciate the methodology and the way. It's showing mutual respect. It's seeing health as an investment that will have a return on that investment. That return mightn't be written in dollars, but that return will be written in disability-adjusted life years, in productivity in society, in stability in society, in less migration, in less communal tension and violence. That's how you return, and we have to get better actually at determining what ROI is in the situation of health investments. But I do think that approach to seeing the people we serve and the governments that represent them, holding them and ourselves accountable to the populations we serve. We increasingly, and Ched, you know, we're doing this a lot, we're talking about accountability to affected populations. They're in different countries and different geographies. They're under different regimes with different political ideologies. But ultimately, we're accountable to them. We hold ourselves accountable for that, but we have to hold the governments that serve them accountable. And they have to see health as a central investment. And we have to help them invest in health. Because the model, and it's been a very successful model, and Ted reminded me of that earlier, ODA and development assistance has saved millions and millions of lives. But we need to start evolving away from an ODA culture towards a culture of investing in health. And that's why I think the partnership with EIB and others is so important. Whereas today, as of this morning, we had 1,200 signals of possible outbreaks around the world. We're currently tracking 367 events around the world. We're dealing with 40 graded emergencies, 17 of which are the highest grade emergency for us, grade 3. The world is biologically and biomically unstable. The climate is unstable. Our populations are increasingly unstable. Conflict is growing. And the convergence of conflict and contagion and climate is driving certain parts of the world, like the Sahel and Horn of Africa and others, they're literally falling away from the rest of the world. When we talk about fragility, conflict, and vulnerability, countries and geographies in that situation will generate 2/3 of the women who die in pregnancy and childbirth, half of the children who die under 5, and 70% of high-impact epidemics in the next decade. They will drive migration in the world. They will drive conflict in the world. It is not only in the interest of humanity to invest in those countries, but it's actually in the security interest of those in Europe and elsewhere who have the money. And I know EIB and the European Union and the Commission recognize that, and very much grateful for that. Thank you.
Thank you very much, Mike. Very, very exciting, and I like the concept about having to invest more in health rather than looking at this as a cost. And in this regard, I think EIB has been very, very innovative and helping us, specifically in the case of all this vaccine manufacturing. They have been really key players to help us move that forward. Talking about EIB, I just would like to turn to Felicitas Riedel, Director of Innovation and Competitiveness at the European Investment Bank. Felicitas, we've heard from VP Östros and our different panelists about the importance of partnership and relevant projects that you undertake in health. But could you also tell us about the characteristic of your investment, including how you ensure the health projects are sustainable and tailored to the specific need of the community they serve, the role of innovation and technology play in your project, and how you define project success? I think because this can be a very good lesson, particularly after Mike's statement.
Absolutely. Thank you so much for allowing me to give our EIB perspective. First, I would like to reiterate and reassure everyone in the room, EIB remains, has been, and will be committed to global health. So we will, despite all the challenges that the world is facing at the moment, we will not step down in our activities in the sector. And this is due to the fact, as we are fully aware, on the impact that investment in health shows. What you just heard is an illustration about the type of intervention and the type of projects that EIB is supporting in global health. To come back to the question that was specifically asked is, what are the characteristics of our investments? I think part of it you could already sense from the speakers previously, but what I would like to share with you are 3 key points. One is all our investments are tailored to community needs. So we really prioritize or invest into projects that address specific health needs in communities. How we achieve this is also with our partners, be it with the WHO, UN, or the European Commission. Second, we pay a lot of attention to sustainabilities. So we ensure that all the health projects are sustainable by incorporating our ESG criteria to all our investment decisions. And this has an impact that we promote long-term health benefits and thus also increase resilience. Last but not least, a key characteristic is that all our, or common denominator of all our interventions in health, they need to be universal. So access to healthcare should be universal. Healthcare should be effective, safe, and affordable. And in particular, it also needs to serve underserved regions and not just the main capitals, for example. Innovation in this aspect plays a crucial role. Innovation can be seen in several aspects. One is that we have innovation in the terms of healthcare delivery, and here I would like to reiterate, in particular, in the context of low and middle income countries, that digitalization plays a major role here. It opens the door to telemedicine and different types of innovation. AI is also opening the doors to be in the innovation front from countries which do not have maybe a legacy in some of the classical sciences. We also support R&D for innovative products, and the example I would like to bring here is a biotech company in Rwanda that we supported for a novel liposomal medicine product for the treatment of tuberculosis. How do we achieve the digitalization that I was also referring to? Here, it's important to also invest in the digital infrastructure. And here, I wanted to highlight again that we supported a high-speed fiber optic cable under the Mediterranean that will allow better access to universities, research organizations in Morocco, Algeria, Tunisia, and Egypt. Key point here to realize is innovation is key. Innovation can take place in various types of elements, and the right infrastructure and ecosystem is necessary, and EIB is looking at all of those aspects. How do we do this furthermore? We have a different set of financial instruments. As you can see as well with what was represented here, there are different solutions that are necessary for the different types of interactions. So we do work with the public and the private sector, and we do offer solutions which are more in the higher risk category to the sovereign loan, and we are very keen as well to discuss novel financial instruments, novel solutions that help to address particular, we call it in our language, market failures, but where we see particular areas of need. Last but not least, how do we measure impact? So this is something that is extremely important, and I would like to reiterate what Mike has said. We need to bring to the attention, I think, of everybody in the room that the economic benefit of investing in health is significant. And this is something for all our projects, that we do not only look at the financial return, they need to be financially sustainable, but highly important is it needs to have a positive and significant economic return. And this is something that we need to share and share with our board, that is based on the decision that will allow us to provide those financing, and our teams, and that's why we have the technical team as well that I'm responsible for, where we have economists that are specifically trained, have the right expertise to be able to make these type of judgment calls that allow us. Let me conclude here, just reiterating again, health is important. We are very grateful to all of you here, and we remain open for discussions and of any interesting projects that you may want to bring to our attention. Thank you.
Thank you very much, Felicitas. Really good point. Before turning to the audience, so if you have any question, just keep it. I just want to give an opportunity to each of our panelists a minute to give your own perspective and to react to each other, just to be more optimistic about the future of global health. We all know that it is increasingly complex, but we need much more flexible partnership. And I would like to ask to each of you, what do you see as the biggest opportunity in global health? And how this biggest opportunity can be maximized in such an uncertainty context. I want to start with Mike for that one, and want to give to each of you 1 minute. And please feel free to react to each other comments.
Yeah.
Please, Mike.
I'll be less than 1 minute. Despite the various withdrawals of funds and the stresses the system is under now, something remarkable has happened in the last 30 years. I've been at this for nearly 30 years. And I've done everything that you can do in infectious diseases or humanitarian response, from treating the Ebola cases to burying the bodies to doing whatever Ted and others have done the same. And historically, that was very much an outward-in solution. Experts come from outside, solutions come from outside, science comes from outside. That has entirely changed. If you go to Uganda today, you go to Tanzania today, it's African scientists, it's African clinicians, it's innovation in situ. Now, we still need those partnerships north-south, but the greatest hope I have right now is that it's not the dependencies. There's still economic dependencies, there's still financial dependencies, but what has changed is the capability between and within countries has democratized. There's been a massive scientific emancipation in the world, and we need to leverage that now. We need to invest in those scientists, those public health professionals, those technicians, those innovators in both public and private sector who are emerging all over the world, because it used to be so one-sided. It's not anymore. Now, we can use our financing to leverage and drive that forward, or we can put everyone back in their box and say innovation comes from the north, and you're the beneficiary, the recipient, and I'm the giver and the donor. We need to change that language, because in our world, in the world of science, there's been a massive emancipation and a massive demand. Amadou, you're a living, walking, talking example of it. Maybe I am a little bit myself coming from Ireland, but I think we need to leverage that.
Thank you, Mike. Ryan, please, if you want to react to that, please.
Just to build on that, I completely agree that I think there is a process of democratization of capability that's happening. It's well underway. I think there's also a process of accelerating innovation across multiple fields, and there's going to be a convergence. There already is a convergence of innovation that's going to be synergistic in terms of what it can produce for patients and for population health in the future. I think the greatest, I wouldn't say impediment, but I think the greatest opportunity for the world is really for the institutions that can really bring together nations and people and resources to sort of get to establish an even stronger institutional alignment to help bring that, connect that capability that Michael alluded to with the innovation centers that are emerging, and be able to channel that into actual, new products and services for global populations. I think that institutional support, such that many of the institutions here represented can provide, I think is going to be the crucial link to bring it all together.
Yeah. Ted, any reaction to that
I think we're going to have a common theme here, but look, I think in reactions to some of some tectonic shifts that are occurring globally, a number of countries are realizing that they need to up what they invest domestically in the area of health. And I can give an example of Nigeria, which has said that they will now be putting an extra $250 million into the national health budget from domestic resources in order to be able to accelerate results towards health outcomes. This doesn't mean that partnerships are not important, but I think it's a different dynamic in how we will work with each other. And the second point I would make is I think in a multipolar world, how can we take advantage of that multipolarity so that the kind of innovative financial arrangement that EIB and the EU put together to support the polio effort can actually crowd in more actors from different parts of the world. So let's take advantage of the fact that we're in a multipolar world now.
Yeah. Felicitas, any reaction to these opportunities for the future?
I think, first of all, I can say we fully agree from our perspective. What I want to highlight is partnerships are essential, but we need to build on each other's strengths. So we need to make sure that we are complementary to each other, not the example that was used to provide 84 individual instead of working together and decide with one solution that would work forward. And in addition to that, what I also want to say is it's essential to create ecosystems. So it really needs public and private sector to work together to achieve what we want to achieve. And I still see a big potential, but also still need to invest further into the upskilling of the necessary very bright, young, and motivated population in certain countries, but to give them the means and the access to exploit this potential fully.
Thank you. Bjorn, do you want to react to any of these comments or have your own perspective on that?
Has it all been said already? Did you say that? Michael, I think you laid it out so nicely. I think one of the, and we are in a really difficult situation right now. We open the newspapers every day, and we wake up in the middle of the night and we look at the news and see what's the latest challenge. And I love the optimism on this stage, and finding solutions, and the way that we're talking about the barriers that have been broken down between the public and the private, and really inviting everybody in a partnership to find solutions. I think that is really inspiring. The other thought I wanted to leave you with is on, could we bring back Hans Rosling and Gapminder to remind us of all the good progress that has happened over the last 50 years, 70 years? Because what we're seeing today is that a lot of people are turning inwards and they're feeling despair. And they start focusing on the very, very super local, and you forget about the global. So let's remind us all of the good progress that we are making, and that we will do it again. And I think that the examples during COVID with mRNA and the innovations we saw there, those are wonderful examples of what is to come.
Oh, clearly, and I like also all the different comments because it carries a sense of optimism. I mean, Winston Churchill used to define optimists like people that see really opportunities in any challenge, while the pessimists are the one that see challenge in any opportunity. So I just want us to be very optimistic, at least in that way. Now, I would like to really, after thanking our amazing panelists, give an opportunity to the audience to ask some questions. If you just can introduce yourself, and Mike, I think, is probably circulating. Any question from the audience? Please.
Hello, Massimo Cingolani from European Investment Bank. I work in the Global Directorate, and I listen very carefully to what Michael Ryan said. about the challenges in the fragility countries for providing health. And so my question would be, in your opinion, what would be the priorities in this particular area, and how we could possibly try to further bridge the gap between what Felicitas rightly called the economic return of these projects and the financial return, which probably is going to be relatively low in this area. Thank you very much.
Thank you. We may have time for one more question, one or two more questions from the audience. In the back there, please.
Hello. That was very insightful. Thank you very much. My name is Tom Plummer. I'm one of the founders of a drone company, Wingcopter. We deliver medicine, lab samples, blood, vaccine for UNICEF in Malawi and Vanuatu. We have worked with Red Cross in Japan lately. And luckily, the family office behind BioNTech is also our shareholder. So we are very grateful also we have received some funding from EIB. 40 million as a venture debt to build this business, and we are working to give or to improve access to healthcare worldwide. My question would be, how much would such innovative solutions help you to improve your work? I just came back from a conference in Indonesia, 17,000 islands. It was a conference by IFC and the World Bank, and it's 20% are populated, but the problem is really access to healthcare. Half of the world's population is lacking good access to healthcare. So would such innovations help you, looking at the really great group of people here? We're also in talks with GAVI, so I know with regards to GAVI there is already some ongoing discussion between us and GAVI, but I would like to hear your take on the access problem, because one is creating great vaccines but then delivering it is really a challenge these days, especially in the hard-to-reach areas of our planet.
Thank you. Maybe I want to return now to the panelists. Probably, Mike, you've been asked about the fragile states and potential opportunities and solutions.
Sure. Thanks, Massimo, for the question. And Ted might want to weigh in on this one too. I mean, this is essentially where we're seeing this concentration, where that climate contagion, conflict, these countries are rolling from crisis to crisis. If you go to the Sahel, you'll see drought crisis, then you'll see ethnic or conflict between fishermen, agriculturalists and pastoralists over water resources, and that's driving inter-communal conflict, which is then driving political instability nationally, which is then, and it goes on, and then there's an outbreak of meningitis, which leads into something else. So it's that permanent crisis, polycrisis, and what that's doing is eating away at any government's ability to remain stable, within the border, between borders. And that fragility is driving a reduction in health services. The thing about health services, it's part of the state's commitment, and be it a public or private system, you need stability to deliver regular, predictable services of any kind. It's like the post service, it's like any service in the country. And the health service suffers. When health and education suffer so much that people can no longer rely on them, they move. They leave where they are, right? Food insecurity, education insecurity, health insecurity drive things. It's rarely at the point of a gun that people leave anywhere. People are remarkably resilient of staying in place in the context of conflict. But what drives people to move is when there's no future education for my kids, when my parents can't get into healthcare, and where my crops are going to fail because I can't get to the field, or because there's a drought. And I really do think we have to rethink this particular context, because you're dealing with a fragile government situation. Vertical programs work well, I suppose, relatively well, when you've got a lot of excess capability. Because a vertical program brings a weight into the system. It's an extra stress on the system. A well-functioning system can take a number of vertical programs. We can have PEPFAR over here and the Global Fund here and WHO and GAVI and everything else. We can have all the initiatives in the world. The system is weighty enough. When you get to this fragile situation, the system cannot cope. Multiple vertical programs further disrupt healthcare delivery. They don't actually improve it. We need to get back to essential health service delivery model, back to primary health care, back to horizontalizing health services and pushing vertical programs to become horizontal at the peripheral level. That's what polio, we'll be talking about in a little while, that's what polio is really attempting to do. And that localization and that accountability to affected populations. So when the person sees the service at the far end, they're not seeing the polio program, they're not seeing the yellow fever program, they're not seeing GAVI, they're not seeing WHO. They're seeing a basic, essential health service. And this is where we're seeing the greatest impact, as I said, on food and health, gender-based violence, sexual exploitation, trafficking, all of these things. And everyone has a program to deal with that, but no one is integrating at that peripheral level. And that's then further undermining the governments. So I think that for me, it's really focusing in on what is the essential minimum level of health services that we, as a collective humanity, are not prepared to let any human being on this planet drop below. What is the minimum? And can we deliver that effectively in those settings? When you bring that level of health stability, and you do the same in education, it's incredible the benefits you get from that, because it drives peace. It drives the reduction of conflict. So we have to see health as a peace intervention, health as a stability intervention as well.
Thank you, Mike. As we are running a little bit out of time, probably Ted, if you want to react to this specific point and also take the question about logistics, supply chains.
Absolutely.
Which is one of the
very briefly on fragility. I mean, if 50% of preventable mortality is in fragile contexts, we need to continue to focus on those contexts. And we forget that there's ways of investing in those contexts that actually have a very positive return. We forget that Ethiopia's vaunted health extension program arose out of crisis and food vulnerability and saved millions of lives since then. So it's a positive, not just economic investment, but a positive financial investment, actually. It's quite cost effective. And I love the question about the drones. Absolutely. I mean, we were with you on the Malawi experience, and it's so nice to hear of drones doing something nice as opposed to being a weapon of war in Sudan or Ukraine or anywhere else that they're being used as a weapon of war. So thank you for reminding us that drones can also be an instrument of peace.
Thank you very much, Lid. Thank you for this. Ladies and gentlemen, as we are coming to the close of this insightful session on global health partnership, I just would like to comment and reflect on some critical discussion that we had. Number one is the power of partnership, which is really, for me, what we should see as some sort of tools that we all can rely on to build a very optimistic future in these uncertainty times. The second important point I think we've touched was the power also of innovation and technology. We just talk about drones, but we know AI, we have messenger RNA, digital platform, are also an opportunity not only actually to solve a global health problem, but in the global south to have an opportunity to leapfrog and to develop more autonomy when it comes to taking their future in their own hand. And the last bit, the need of sustained investment. I think that piece is really, really important. So before I conclude, I just want to extend my gratitude to our estimated panel for their really, really good insights, the EIB staff that helped us prepare this session, but all of you for your engagement today. Finally, I would like to encourage everybody to think about the role they can play in health. This is something extremely important in terms of partnership. I want to thank you all once again, and I look forward to continue the conversation and collaboration that will emerge from this forum. And to close the session, I would like to invite John Gilsetter, Managing Director at GAVI, to give a closing remark. John, over to you. Enjoy the rest of the EIB forum. Thank you.
Thank you, Amadou. I thought you closed this session much better than I will. So I'm just going to keep it to 3 quotes. We live in a time of crisis that's been recognized, so I thought I'd look up who has said something wise about that. But Albert Einstein, every crisis offers new opportunities. We've got Machiavelli, never let a crisis go to waste. And then Churchill, don't waste this crisis. And I think there's an opportunity here for all of us to think differently, and I think this panel has said that in so many ways, whether that's by bringing in, innovating new vaccines, or whether it's about delivering with drones in Rwanda and other places. So thank you very much for convening us, and thank you, EIB, for this.
Thank you so much, Amadou. And I would like to invite Ted and Mike Ryan to stay on stage because, and yes, and thank you to all of the panelists. Thank you again to Amadou. We are going to now talk a little bit about one of these international partnerships and the proof of it working. It's the Global Polio Eradication Programme. And to talk a little bit more about this, I would like to invite once more Thomas Östros.